The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another edition of The Genuine Article. And I'm in Italy, the home really of athletics and screening for cardiovascular disease. And I've got the pleasure of speaking with Dr. Antonio Policia. And Dr. Policia is the scientific director of the Institute of Sport and Medical Science in Italy, and a prolific author in this regard. Now, some years ago, Antonio, we published an article coming from France indicating that elite French bicyclists actually manifested some evidence of cardiac dysfunction. So you aimed to conduct a study to look at that further. Can you tell us about that?
Yes. Exactly, that was also our purpose. We wanted to verify if the athletic training by itself, very intensive and prolonged for an extended period of time, we want to verify if this particular stimulus was sufficient to modify left ventricular morphology and function, or in other terms, if it was responsible for any left ventricular dysfunction.
And you really had a unique group of patients, Olympic athletes.
Exactly. We had the chance to utilize our database, which is really unique. In our institution, we have a medical program in which the Olympic athletes are included. All very elite athletes participating in the Olympic Games, Summer or Winter Olympic Games, or major international events such as the World Championship. Those athletes came to our institution before the events, and we have implemented the cardiovascular program, including routinely the EKG and the echocardiography, in addition to exercise tests. So we had the chance to look at these athletes, and in particular, to address this question. We look at those athletes participating in the most strenuous sports activities, such as cycling, or mid and long distance running, rowing, canoeing, triathlon, or cross-country ski. So those athletes were reported by us and by other authors having the most marked left ventricular remodeling.
So did you looked at these Olympic athletes over a long period of time?
Exactly. We decided to select our population among those very elite athletes for, in particular, looking at the changes occurring in athletes that had participated at least in 2 consecutive Olympic Games. And we were lucky because we had a population of 114 athletes who participated from 2 consecutive up to 5 consecutive Olympic Games. So for over an extended period of time in which they were chronically exposed to very intensive athletic conditioning.
Yeah, elite athletes who exerted themselves to the maximum. So what did you find? Did they hurt their left ventricle?
Not exactly. Not exactly. We were able to have repeated measurements of left ventricular morphology and function with the same machine and same operators and the same athletes over time, and we found no changes for left ventricular dimension and no changes for left ventricular function. So the main results of our investigation was that the athletes, despite exposure to such an extensive period of time in which they were training very intensively, had no clinical events, no symptoms, no evidence of incipient cardiomyopathies, and the left ventricular function remained substantially unchanged.
Well, when we reviewed this manuscript, one of the points that came up was the fact that in some of the marathons or in the Ironman events, swimming and running and bicycling, that there's been reported an acute depression of left ventricular function. And as you know, we published that article from France showing in elite cyclists that there was some evidence of left ventricular dysfunction. So the question is, why the disparate results?
Obviously, there could be a different selection of the population. I want to underline that our population of elite athletes is a very selected population. Those athletes are serially evaluated in our institution, so we have a long-term story, medical story for them. In addition, these athletes, just because participating in these international events, are exposed to a very strict anti-doping policy in our country. And all of these athletes had serial anti-doping control that turned to be absolutely negative. In addition, they were relatively younger than certain cyclists participating in Tour de France and previously reported, or other Japanese long-distance runners. So I think that our population represented the best physiological model to assess the independent effect of training on cardiac morphology and function. We cannot exclude that other possible determinants may have impact on left ventricular function in older or professional athletes.
Yeah, and of course the use of drugs is often very, very difficult to verify, so we can never be 100% certain of that. So is it possible that some of the athletes who developed cardiac dysfunction were disqualified from participation, and that's why they did not appear in the multiple Olympics?
We addressed this question raised by one of our reviewers, and we assembled a control group for these athletes. Actually, this control group, in brackets, had exposure to very intensive training in preparation for the Olympic Games, and they eventually did not participate in the Olympic Games because they failed to achieve the results to be included in the Olympic team. Also, other athletes that were included in the control group participated just one Olympic Games and then they quitted because they were not able to achieve the results. Also, in these athletes that were not exposed to such long-term training at the very high level, so we didn't find any change in left ventricular function. So we believe.
Let me ask you that question again. You give a much shorter answer if you can. So one question comes up: is it possible that some of the athletes did develop left ventricular dysfunction, but they were disqualified from participating in further games, so they didn't get included in your sample?
We were aware of this possibility, and we assembled the control group to compare with our elite athletes. Control group that included athletes that were training very intensely, but eventually were not participating in the Olympic Games because they did not achieve the best results to be included in the team. And we did the same repeated measurements also in this control group, and we also found no changes occurring over the period of observation. So we believe that it's very unlikely that our selected population represents a bias of selection.
Well, excellent, important data. I think it certainly encourages me to continue exercising on a daily basis. For the Genuine Article, I'm Tony DeMaria.
The Genuine Article. Discussion and commentary based on articles from JACC.